When you meet someone for the first time, you notice their face. And when someone is born with a congenital facial deformity or they receive a craniofacial deformity through a traumatic injury, that can be a very uneasy situation for both parties.
When you correct a child's facial deformities, you actually give them a second chance in life, and otherwise they're left with deformities that are severely physically as well as psychologically crippling, and they never really can have a full developed life in that sort of state.
That's why the CranioFacial Foundation is working to restore smiles.
There's a certain incidence of congenital facial deformities throughout the United States. And there's almost an epidemic of facial trauma. Almost everyone knows of someone that's had some type of facial injury.
The Tennessee CranioFacial Center was established in 1987 by world-renowned craniofacial surgeon Dr. Larry Sargent.
There was a need in this part of the country because there weren't any established regional craniofacial centers in this particular area, and so that type of treatment, which was relatively new back then, was not available to a lot of patients.
He brought together a team of physicians and specialists to treat these children who were born with congenital facial disorders or for traumatic injuries.
The center functions to help provide continuity of care, and it's a multidisciplinary team approach where we have all the different specialties, including ENT, orthodontics, dentistry, speech and hearing, and craniofacial surgery. Treating craniofacial deformities is a journey. It's not just a one-step process. Treatment can start at infancy, and it can last through adulthood.
The earlier you can start, the better outcome you have when they're 18, 19, 20 years of age.
The entire focus of the craniofacial team is to improve the quality of life of the patient.
To a parent of a child that's born with a deformity, it can be a devastating event in their life, because we all want our children to have the most normal life they can.
It has a tremendous influence on their overall self-esteem, their psychological makeup.
Becoming a parent is scary enough, but now you've added this component to it, which makes it even more uncharted territory.
My second child, Jackson, was born with facial differences. He was born with cleft lip and cleft palate. It was very shocking. It was something that we were unprepared for. Clearly, we were prepared to be parents because we already had another child, but not one with special needs.
They say, we are here to help. They're here and they know what their needs are.
The first day, someone from the CranioFacial Foundation came to visit us, and it was so refreshing. It was very comforting to know that there were other folks out there that were just like us. As a mother, that was the most important thing that ever could have happened to me at that time. It gave me a peace to know that this was going to be something that I shared with other people, that we weren't alone in it, and that there was a family here in the Chattanooga area that was willing to help and go along with us on our journey.
The foundation helps to really support the families. They provide the emotional support, they provide educational support, they make sure that we have literature available that we can use to help provide the families with more information about what's to expect. They help to provide housing for the families, they help to provide transportation support, psychosocial support. They have a great parent-to-parent network. They're able to really care for them as a whole and not just simply meet their medical needs.
One of the programs that we do is our Dreams Can Come True Family Camp Weekend. Another one is our Mother's Retreat. This is a time just to bring them together to give support emotionally. We also do an international missions trip called Project Happy Faces that the foundation supports. All of these programs are of no charge to the families.
A lot of the children we see are from maybe socioeconomic deprived situations, and a lot of your healthcare providers kind of shy away from that.
Even if you have insurance or if you don't, that can be a big burden and a lot of weight to carry.
One of the goals of the foundation was to sort of level the playing field, to help those families in terms of the financial stress that it would put on them.
When you give to the Craniofacial Foundation of America, you are lessening the burden for a family that is in for a very long journey.
Many communities do not have these sorts of teams, so Chattanooga is fortunate to have a regional craniofacial team here.
85% of the families that we assist are from the Chattanooga area and surrounding areas. We have serviced about 42 different states and 15 countries. The Tennessee CranioFacial Center supports a clinic once a month at Children's Hospital at Erlanger. That's a time when the doctors come together one morning and the families travel to Chattanooga to be evaluated, and they can come up with the treatment plan and the protocol on an individual basis. The foundation supports the families who are traveling to Chattanooga for their evaluation and treatment through helping to pay for lodging, food, and travel.
Being associated with the Tennessee CranioFacial Center and seeing how the Craniofacial Foundation of America really helps to truly care for the patient has been very touching and very rewarding.
It's a blessing to be able to come to a place where they know they can get the proper care and get a good outcome. We have an opportunity to make a big difference in a child's life.
The CranioFacial Foundation is very important to me and to my family for their support, for their educational tools. It has become a family to us, a family of resources, of comfort, and to help guide us along our journey. And in return, we also want to become part of the family to help new parents that are experiencing this with their children.
It's such a help knowing that my daughter, she can have a normal future. It's a great thing.
When you give to the Craniofacial Foundation of America, you're helping to restore someone's hope and someone's dignity. You're actually giving them a second chance at a normal life.